Annual healthcare options can be confusing and an expensive process.
Right now, the average full-time worker pays a little more than $5,500 a year for family coverage. There are HMOs, PPOs, HSAs, and FSAs. Lots of acronyms. Starting tonight, ABC 17 News is helping you navigate the process with a series of reports we're calling Prescription Mid-Missouri.
And we start with ABC 17's Alyssa Toomey, who is here to help explain healthcare costs and the 3 basic insurance concepts you need to understand.
These concepts are premiums, deductibles, and out-of-pocket maximums. I'll explain each shortly, but first, let me tell you about the Prescription Mid-Missouri page on ABC17news.com. We've built several interactive elements for you to explore, including an online glossary.
Meet Lynette Preston. She has 2 children, ages 7 and 20. Preston's health insurance is provided by her employer, and like most families, she's struggled with the rising cost. Her daughter was previously on her plan, but she now has her own.
It was expensive. Like, it definitely doubled.
A premium is the amount that must be paid for your health insurance or plan. In Preston's case, the cost is shared with her employer. She prefers to visit the doctors that took care of her throughout her pregnancy, so that's how she chose her plan. Do you know whether it's like a PPO plan?
I don't. No, I have no idea.
But you're able to go to any doctor that you want.
Right. Well, the specific ones that I like to go to.
Right.
Yeah, that I've been using for years.
Preferred provider organization has in-network and out-of-network doctors. So if you go to the doctor that your health plan has a relationship with, you're going to pay less. HMOs use the primary care provider, your family doc, as kind of a gatekeeper. You can't go see other specialists unless they refer you to those other people. If you have a high deductible plan, meaning the insurance company doesn't pay until you've paid a whole lot of money out of your pocket, POS is more a kind of a fee for service. You pay a certain amount a month, and then you're paying it to a primary care provider who meets all of your needs.
Most health plans also include an annual deductible. That's the amount you're required to pay before your coverage kicks in. According to the Kaiser Family Foundation's 2018 Health Benefits Survey, the average PPO family deductible is $3,000. It's just over $1,200 for individuals. Preston's case is also unique because her son was born premature and has to see a cardiologist every year. To keep costs low, she's had to strategize.
Be able to have both of my kids on there at the same time versus, let's rotate her out of here and then rotate him in so he could get the same benefit that she did. Yeah. I should be able to just put everybody on there, pay that amount, but then I'd really be broke, so.
All plans also include an out-of-pocket maximum, the maximum amount of money you can be charged in a coverage period.
It's a limit on your out-of-pocket costs. For example, $5,000 might be your out-of-pocket max.
Preston says rising costs are a concern, but like most parents,
I will pay the price, whatever it is.
Keep in mind, the out-of-pocket maximum never includes your premium, and some places don't count all of your deductible. So be sure to check before you make your 2019 enrollment selections.
Alyssa, thank you. Our Prescription Mid-Missouri coverage continues at 6 p.m. with ABC 17's Lucas Geisler.